Hi, this is Dennis Stanley, and I'm with you today to show you a brand new application on the web called RT Scheduler. Now, this application is made especially for respiratory therapy teaching institutions who are doing the clinical schedule. And rather than do that on a spreadsheet or in a manual way, now it can be done on the web. And the nice thing about that is that when a student logs into their own dashboard, they can see their own schedule and they can receive notifications on that, and that'll help them to know where they're supposed to be and when. So here I am at the login screen at rtscheduler.net, and of course you have to have an account, but I want to show you what happens when we log in and some of the things that you can do in RT Scheduler. So we'll take just a few minutes to do that. We won't go into a ton of detail, but we'll have some greater detail in other follow-up videos on how to do specific things in RT Scheduler, but right now I just want to give you a general overview. What happens when I first log in, I want you to know that I am from the perspective of a teacher or a coordinator or a scheduler. And so I also have a dashboard because as a clinical instructor, I might also be clocking in and out. As you can see, it shows that I'm clocked in right now. I could push any of these buttons and then I could start my lunch period, or I can ultimately just clock out. So it tells me where I'm at and how to deal with that. So now I've clocked out, so now the clock in button is there. And we'll talk about this more in another one, but it shows basically my clock in data here and there. And this is basically what each student can see when they get in on their dashboard. If you look over here, we can choose what hospital or what clinical site they're at before we clock in. And this is all the first part of a suite called Amber Student Academic Portfolio, which really tracks all of the clinical activity of a student. Now this part is just the scheduling feature. It's independent of the rest of it, but soon to come is the ability to manage procedures, to document them, to manage physician interaction time, as well as do competencies with clinical instructors, and basically is an archived system that meets the federal criteria or the criteria of COARC. And so that's coming, but this is just the first part of it. And it's a standalone application that can be used right now. So as I go into the menu system here, again, I won't go into great detail, but you have the dashboard. You'll probably be spending most of your time in making and editing and publishing the schedule, but you can do other things like manage students and clinical sites and add students and schedulers and so forth. I'm going to take you straight in to looking at making and editing a schedule. So as I click on that, it'll go into that system. It has to wait just a moment, and then it populates the current dates, and we can navigate around. Notice up at the top that we can look at a month view. If I do that, we can see it from that point of view. We can look at a biweekly view, which is really the view that you probably want to use when you're actually doing the scheduling. But we can do week, day. We can even look from the point of view of our locations. Now, from a couple of these things, we can schedule people. As you can see, I'm scheduled here at Norwalk Hospital on the on this date and at 4 o'clock in the morning. And then, of course, my shift goes from 4 to 1. That's an odd shift, of course. But let's go back to the biweekly view. Typically, what you have here is you have these little shifts here. And look at this red line here. This red line is movable. This red line is what's called the publishing line. And so everything on the left side of this line is published. And all we mean by that is if a student logs into their own dashboard, they can see these shifts. So if I want to develop the schedule before they can see it, I just move this line around and I start creating shifts on the right side of that line. So here I have a student, and you see it, they each have their own little color codes and placards. Just depends on how many students you add, but right here we have, let's see if we hover over here, we have James Smith. Now I can grab James and I can come over here and I can say his shift is going to start at 7 a.m. And as soon as I do that, it wants to know a little bit more information like what the end time is. It just kind of defaults to an 8-hour shift, but let's say I say this is going to be at St. Catherine, and then I add that shift, and then it'll just add it there. Now notice it just adds a square. If I hover over it, and even if I click on it, it'll expand to show the degree of the shift, and it just kind of depends on how big your monitor is in terms of what you can see. But I can also go ahead and just stop for a moment and I can edit that shift if I want to. I can change the time or the date and put it somewhere else if I want to. I'm just going to cancel out, and then that's really how shifts are added. So I can just add this and pick a hospital and just add it as I go along. I'm just adding these people to the schedule. Now, they don't know anything about this because I'm just working on the schedule over here. But if I were to take this line and I were to move it to the other side, then they become published at that point. So if they logged in, they can see it. Now look, I can move it right back and remove it from what they can see, and then I can continue to work on the schedule if I want to. Notice also if I move it over here, there's a button that can turn orange up here called Send Changes. And this system knows that if you have scheduled shifts that you've published that haven't been notified out yet to the students. And so all I have to do is click Send Changes, and then it'll send emails to everybody that's involved, and so you can go out and do that. So those are just a few things that you can do with the schedule. Let me take you into the location view. That's kind of interesting. We can come in here, we can look at, as you see, these are the shifts that we just planned here, so they're all there now. I can also do something interesting here. I can take a peek at St. Catherine themselves by expanding this window, and then when I do, I have some other features here. And I like this feature here because I can send email to the contact person at St. Catherine and let them know about the schedule that's coming up. And so I can send the schedule directly to St. Catherine, the contact there, and it'll include only those people that are scheduled at their hospital for that time. So I'll just hit send and it'll send that notification right out. And it says it's done, and then we can close that. You can see yourself, but that's basically how the scheduling system is going to work. Now, if you look at some of the other views, here we have the monthly view. It's not going to show all the detail because you may have lots of people on, for instance, Tuesday the 8th, but it does show if there's a hospital there that that there is some schedule on that date. If I click it, it actually just takes me to the day view so we can see who's scheduled, when, and where. And so you can come down here and see what's going on. Okay, and we have nothing scheduled there right now. So, okay, anyway, that's just a brief overview. There's some other things that you can do here that we'll cover in more of a detailed video, but that's how you can utilize RT Scheduler to begin making the clinical rotation scheduling for your respiratory therapy program.